This is part of a long program with a combined symposium sponsored by EHA and the European School of Hematology. And every year we put a real clinician on the stage in front of 100 to 150 people with a pre-arranged, difficult conversation to have. Not scripted, but pre-agreed with the clinician. And today, Ben Kennedy, the hematologist from Leicester, was seeing a couple, an older man with difficult to treat Hodgkin's disease, was being lined up for an allogeneic transplant, come to clinic with his wife, who brought with her a letter from their GP to say that he had seen the patient a couple of days previously and thought he had early Alzheimer's, and had done a fairly detailed evaluation to suggest that that was the case. So really difficult conversation. Alzheimer's would be a contraindication to something as intensive as an allogeneic marrow transplant for several reasons, I think, starting with the fact that it would be very difficult for a patient with significant dementia to consent to a procedure as complex and potentially risky as an allogeneic transplant. And then very difficult indeed to get through the hospitalization, the infectious complications, the multiple hospital attendances, possible graft versus host disease, when they were in a mental state so fragile, irrespective of whether the wife was able to support him through the process. And she, of course, was very keen to argue that that would be the case. So really tough conversation for Ben to have with them. And it elicited a lot of interest from the audience as well. Conflicting views in the audience, which is always good. We never intend to put these things on as a masterclass. We intend to put them on to make people who watch the scenario think how they would handle it themselves if they were in this situation. So a couple of people in the audience thought that Ben should have ducked addressing the issue of the Alzheimer's and the difficulty with consent and tolerating the procedure, at least in the first consultation. Perhaps arranged some further investigations with a colleague, gone back to it 2 or 3 days later. Ben was very resistant to that, and I think he got support from the audience that it was a difficult scenario. It might require more than one conversation, but it wasn't appropriate to duck the complexity of the issue from the very beginning.